For those of us in the Medicare world, the fall is a time when there are pumpkin-flavored everything. Candles, mocha lattes, hand lotions, and Medicare Advantage plans. Well, maybe not that one, at least not yet. But it also means that there are a lot of choices to be made about a person's Medicare plan options for the year to come, 2025 that is. So today, for those folks in San Diego, California, we're going to give you a crash course on some of the plans that are available this year during AEP. And look at them together and give you some perspective on which plan you may want to choose. So here are 5 things to look at on the Scan Alta Medicare Advantage plans and the Blue Shield 65 Plus plan available in San Diego in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. For our clients in San Diego, the choice between Medicare Advantage plans offered by Scan and Blue Shield happens really more often than one would think. The main reason for this is that both the companies have a strong presence in Southern California overall, but their benefits are really designed to be focused on specific hospital networks, doctors networks, and the needs of specific clients. So sorting out whether their strengths and weaknesses can be the difference of having a plan that fits a beneficiary's needs perfectly, or maybe it doesn't. So here are the 5 things that I would look at on the Scan Alta and Blue Shield 65 Plus Medicare Advantage plans in San Diego in 2025. For our clients who are new to Medicare, meaning they are often coming in without any specific doctor's networks or healthcare needs, one of the key things that we will always look at with really any plan is the maximum out-of-pocket cost on a Medicare Advantage plan, also called a MOOP. Now, the MOOPs are the most amount of money that a beneficiary could spend during that year on their healthcare. And that includes things like copays and co-insurances, hospital costs that beneficiaries may have throughout that year. It must be clear, though, that the MOOP does not include prescription medications costs, it does not include premiums, it does not include the monthly cost for Medicare Part B. All that being said, once somebody does reach this limit, the MOOP, on each of the plans, then their healthcare costs will be capped for the remainder of the year. Additionally, Medicare Advantage plans have a very wide discrepancy when creating a MOOP. So they range from super high to super low, and they can also change every single year. And we will see that looking into these 2 plans. First up, let's look at the Blue Shield 65 plan. And for 2025, the maximum out of pocket is going to be set at $1,800. Now, this is a very, very significant drop, even compared to where it was last year at $3,800. That's in 2024. I mean, that is a $2,000 drop from 2024 to 2025, which is, a lot, to say the least. So for folks who are interested in a Blue Shield 65 Plus Advantage plan, this is a big plus. Now, when we look at the Scan Alta plan on the inverse, we can see that in 2025, the maximum out-of-pocket is going to be probably one of the lowest ones that you're going to see anywhere around at $500 for the year, which again is down from the previous year in 2024, where it was at $750. Now, I think one thing we are seeing a lot this year for a lot of reasons are plans putting a lot more of their plan points when they're building their plans, putting those points into lowering the out-of-pocket maximums. Of course, this also means that they are having to take those plan points out of some other part of the plan, out of the plan design, and put it into those MOOPs. So again, plan design is another topic for another video, but if you guys want to get insurance nerdy with me, I'm down. Of course, the MOOP is not going to be even close to the end-all be-all of making a decision about a Medicare Advantage plan, but I always think it is a very good place to start. Another important thing to look at with both of these plans, and really with every plan, is the deductible. Because if a plan has a deductible, it means that the Medicare beneficiary will have a certain amount of money that they have to spend 100% out of their own pockets prior to the insurance kicking in. It means things like copays and co-insurance don't even start being applied until after that deductible is paid. In this case, neither the Scan Alta nor the Blue Shield 65 Plus plans have deductibles. And this is, I would say, pretty fair to say, pretty common here in Southern California for HMO style plans like both of these. In fact, it is more surprising when a plan has a deductible than when it doesn't. Of course, save the PPO style plans, which almost universally have deductibles. But there's only a handful of them at the moment or so. Now, one of the most shiny and most noticeable, and probably one of the most used benefits on the Medicare Advantage plan is the cost to utilize day-to-day services, such as things like primary care and specialist doctor's visits, as well as the urgent care and emergency rooms. Now, these benefits typically have a set copay, and it can really affect a person's plan choice, especially if they utilize these services often. More than just like the annual checkup, which we are all definitely doing and should, right? Anyways, when we were looking at the cost for doctors and specialists and emergency room visits on the Blue Shield 65 Plus plan, those copays, so set amounts of money per visit, come out to $0 per visit for the primary care doctor, which is pretty good, as well as $5 copays to go see a specialist. So that could be like a cardiologist or an orthopedist, or my favorite, the ear, nose, and throat doctor. And then lastly, for emergency care or the emergency room, that is a $140 copay per visit. On the other side of that, if we look at the Scan Alta plan, doctor's visits, whether it is a primary care or a specialist doctor, both of those are going to be set at $0. Additionally, emergency room visits are going to be a $90 copay per visit. So this is one area where there's a pretty noticeable difference in their plan structures. One other note about the emergency room is that for emergencies, somebody is always considered in network. So if they go to an emergency room near their home, of course that is in network, but even if they are somewhere else in the country, if say they're in Omaha, Nebraska, for example, they would still be considered in network for emergency covered services and costs. Now let's take a look at some of the extra benefits that are offered by the Blue Shield 65 Plus and the Scan Alta plan, because it is a common practice for Medicare Advantage plans specifically to have extra benefits. And they can offer all kinds of things under this category. It can include things like money for healthy groceries, dog walking, ED medications, hearing aids, pest control, and all sorts of things. But in this case, I want to focus on one particular benefit, the over-the-counter benefit. The OTC benefit is basically money that is set aside for the beneficiary to spend on things that are not covered under Medicare, although they may still be necessary for daily care. Usually they are things that one would find at the pharmacy but wouldn't need a prescription to get. Think Advil or Tylenol or Band-Aids, toothpaste or bug repellent and things like that. On the Blue Shield 65 Plus plan, there is an OTC benefit of $90 per quarter, and so that adds up to $360 for the year. That is if someone does use the full benefits, which is not too bad. If we look at the Scan Alta plan, they have a $150 per quarter benefit, which, if we add that up, comes out to $600 per year. Also important to note here is that the unused quarterly benefits in the case do add up over each and every quarter. So one could spend the $600 in December and buy, a turtle-sized sandbox full of toothpaste if they wanted, but it would not roll over from year to year. So within the year, you can use it or you can lose it. Lastly, and I'm not gonna get too deep on this one because there really could be their own standalone video, and there probably is going to be at some point. And if folks want me to, in fact, we can definitely put it up there. Put it down in the comments if you want that. But each of these plans do offer Part D Medicare drug coverage. And this means that they will cover those prescribed medications throughout the year. Now that being said, each of these plans are going to have their own list of medications or formularies at their own different prices, which really is a big, hairy deal for folks who need them. But they are so specific to each individual. I think the things that I will mention is that there is not a Part D monthly premium on either plan, which is good, and pretty much standard. And unlike the Part D drug plan that is standalone, without the MAPD attached, that is, there is also no deductible that has to be covered prior to the drug copays and coinsurances being applicable. Finally, because the new caps on the Medicare drug costs at $2,000 a year and the elimination of the donut hole provision, whichever drug somebody is taking, universally that yearly cost cannot exceed $2,000 for the year. So that is a nice ceiling. Yes, it is still a lot of money, $2,000, but still way better than it was before. Looking at these plans, or really looking at any plan, can be a complicated mixture of balancing out benefits cost, and one's health situation. And I don't think that there is really one plan that is better than another. It's more of an issue of which plan fits somebody's needs best. And that isn't always the one that has the highest OTC benefit or the lowest primary care doctor's visits copay. It is really going to be based on someone's individual situation. Also, keep in mind, this is literally just 5 benefits that we take a look at here. There is so much more to making a good Medicare plan decision than, just these 5 things. But of course, if you or somebody you know is in the process of looking at which Medicare option may be best for them this AEP or really all year round, and they live here in Southern California, feel free to reach out to us at the information down below and we can help walk them through all of these different plans and figure out which option might fit them best in English or in Espanol, over the phone or in one of our many offices here in Southern California. So that is it for today for Michael's Medicare, and really I hope you enjoyed this video and I hope that you enjoy all of our videos. So of course for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.